Welcome to eMedFx. For the purpose of this demonstration, we're going to be showing you the Nutritional Supplement Drug Interaction Database. To enter this database, simply highlight the Supplement Drug Interaction button, and eMedFx will take you directly to the Nutritional Supplement Drug Interaction tab. Once you've entered this database, you have two search options. You may elect to perform a basic search, or for the purpose of this demonstration, we're going to be utilizing the advanced search option. Let's say, for example, this patient presented to your office taking the following medications. Alprazolam. Simply add that to the selected drugs list. Lisinopril. And Synthroid. Once you've added all of your drugs to the selected drug field, you can then go ahead and search against any nutritional supplements that this patient is currently taking or any nutritional supplements you are considering recommending for this patient to take. Let's say, for example, we were going to recommend that this patient take the herbal supplement ashwagandha. Simply add that to the selected nutritional supplement field. Let's say also we were considering recommending arginine for this patient. And last but not least, calcium. Once you have entered all of your drugs and nutritional supplements into the respective fields, simply click the search button below, and eMedFx will populate all known potential interactions between the medications entered into it and the nutritional supplements. Here you see on this first line we have alprazolam. Its alternative name is Xanax. Its drug class is also listed there as benzodiazepine. The nutritional supplement we searched against, ashwagandha, and there is a potential interaction with this drug and this nutritional supplement. The potential interaction is that ashwagandha may increase the drug's effect. Here is the peer-reviewed research that is linked to that statement. You'll also see that lisinopril, taking in combination with arginine, has a potential interaction to alter potassium levels. And again, here is the reference that's linked to that statement. Continuing down this list, you see that there's also a lisinopril hydrochlorothiazide combo medication. So eMedFx does not just look for lisinopril, it looks to see if there are any other medications that contain lisinopril that this patient may be taking. And you can see the same interaction is known here. Arginine would alter the potassium levels of this drug as well. Since the patient is not taking lisinopril hydrochlorothiazide, we're going to ignore these three options. Continuing on with this analysis, you can see that Synthroid, when taken in combination with calcium, has the potential to decrease the drug's absorption. You'll see immediately underneath that is another record for Synthroid and calcium, also indicating that calcium will decrease the drug's absorption. However, if you take calcium and the medication as far apart as possible, there should not be any problem with this combination. Here is the research that's linked to that statement as well. And then also it lets you know that Synthroid and taking with ashwagandha, there are no known interactions. Synthroid taken in combination with arginine, there are also no known interactions. So once eMedFx has sorted for potential nutritional supplement drug interactions, all you have to do is simply highlight the drug nutritional supplement potential interactions and export them to a patient-specific report. At this point, eMedFx allows you to enter some patient-specific data relevant to this search. Here we'll call this patient Mrs. Jane Doe. Her birth date is 9/22 of 1977, and her chief complaint, let's say, is neck pain. The doctor or provider in this case is Dr. Palmer. At this point right here, eMedFx allows you to enter a report introduction and a report conclusion. Let's say, for example, we were co-managing this patient with Dr. Still. And let's say we wanted to thank Dr. Still for this referral. Thank you again for this kind referral. I look forward to co-managing cases with you again in the near future. Let's go ahead and export this report. Once you have entered in the patient-specific information, eMedFx then effortlessly generates a report that can be stored in the patient's file or shared with other healthcare providers. You see here it enters the patient's name and date of birth. It then continues on to write a brief overview of the information for which it analyzed. On page 2 of this report, you will find the references for each of these potential interactions. At this point, the provider could easily go over this information with the patient and then simply sign off on the line below, indicating that this information has been reviewed with the patient. All of these tasks may be completed by your front desk staff and then simply submitted with the patient's intake paperwork for your review. eMedFx, medication effects, effortless documentation.